Do you know what is post-traumatic stress disorder, PTSD? Do you know what are the symptoms of PTSD? More importantly is, what do we do if we have the symptoms of PTSD? Hi all, my name is Akshita Kaushik. I'm a trauma-informed consultant psychologist working at Maarga Mind Care. I predominantly deal with adult population. So I'll be answering all the questions that I asked in the beginning of this video. To start with, there are 4 major diagnostic criteria for PTSD, and the first one being intrusion. In intrusion, what happens in simple languages? It's basically flashbacks or nightmares that the patient experiences. Giving an example from one of my experiences. So a patient kept remembering this one person who was her neighbor with a knife. Now that was right before the traumatic event when that neighbor took their life, right in front of my patient's eyes, which was the actual traumatic event. But what the patient remembers here is fragments from the pre-event. Okay, that's how flashbacks happen, and the patient responds to this fragment of event, this flashback, exactly how she responded 10 years ago when she experienced the event. So whatever triggers there are in the environment, they start responding to those flashbacks. Their bodily responses, their physical responses, the emotional responses are exactly identical. It mimics how it was 10 years ago when the event actually took place. The second diagnostic criteria is avoidance. Now the patient becomes very aware of what might trigger in the environment, and they do not want to relive this incident again and again. For example, in one of my cases, my patient's abuser had a silver BMW. Okay. Now, what she did was, she was so aware of her surrounding and she was so wary of making sure that she does not spot a silver BMW. She kept avoiding going out even in order to avoid that silver BMW, that sight, because she knew how it would have triggered her flashback. Again, first diagnostic criteria was flashback. Then the third one is negative cognitions. What happens here is, the patient, they start developing sense of guilt, sense of shame, sense of blaming, anger, reckless behavior, right? And most of the times they start blaming themselves for a traumatic event that happened to them where they were the victims. And the fourth criteria is hyperarousal, reactivity, getting startled too easily by the noise of the door, getting startled too easily if there are sudden movements around you. For example, in one of my cases, the patient was so startled that she kept leaving her chair when there were sudden movements by the psychologist or by somebody, her family member even, who she was so familiar with, right? Some fluctuation in the power, that startled her enough to impair her in that moment, to make her forget what she was saying, to make her react to it like somebody was going to harm her. Okay, so these are the 4 diagnostic criteria which are majorly for PTSD. Now, what to do when you're experiencing these symptoms? Please seek help. You do not have to deal with it all alone. Please seek professional help immediately, sooner rather than later. We at Maarga can provide you with that professional help. We are trauma informed.